Hello, Dr. Jay Hitson here with Transformation Life Centers. So one of the questions I like to ask is, do you consider the United States to be a healthy nation? Are Americans healthy? The reason we have to ask this question is because if we do not consider this to be a healthy nation, then we have to change our actions, our habits, and our behaviors in order to get a different result. Now, when we look at where does the United States rank in comparison to other major industrialized nations, we are number one in a few different categories. First of all, we are number one in trauma care, in urgent care. Our emergency room system is the best in the world. If you have a fractured arm, a raging acute infection, there is no better place in the world to have an emergency trauma than the United States of America. Now, unfortunately, we're number one in a few other things that we don't want to be number one in. And one of those is spending. We spend vastly more than any other nation on our health care per capita. Actually, as of 2010, we were over 17.6% of our nation's GDP, our gross domestic product, was going back into just our healthcare costs. And if you look at this particular chart that we have in your packet here, you'll see that not only are we spending more, we're spending vastly more per capita than any other nation in the country. Now, in general, is spending more necessarily the problem? No. If we're getting a great return on investment, if we're a healthier nation than any other nation, if our people are prospering, then it is worth the investment. But are we? Are we getting the return on our investment? And here's the other factor. Not only are we spending more, we're spending more at a very accelerated rate. Whenever I first started teaching on the expenses and what's going on in healthcare back in 2010, this particular chart and graph came out, and we remember thinking there is no way that our expenses will get to $4 trillion by the year 2018. And folks, let me tell you, we hit it on the dot. $4 trillion. Our spending is vastly exceeding the rate of inflation, and at this rate, this nation will go bankrupt. We are also number one in pharmaceutical usage. When you look at this particular chart here, we are spending more and taking more medications per capita than any other nation in the world. And the rate of medications is going up dramatically. As you see on here, from 1997 to 2016, we have had a massive increase in how much pharmaceutical usage is happening in this nation. So is taking more drugs, spending more on medication, taking more medication, is that working? Is that the answer? Are we a healthier nation because of it? Now, here's the other factor that is happening is not only is our system costing a lot and we have a lot more medications, it's also actually very dangerous. Right now, medical error is the third leading cause of death in the United States. So our system is costing a lot. We are spending a lot, we're taking a lot, and unfortunately, it is also becoming fatal to a large percentage of Americans. And as you look at this particular chart in your packet right here, this one compares how much these various nations spend on healthcare versus how long are they living, what's their life expectancy. So the whole goal is to be as much into this corner right here, not spending a whole lot, but living a very full life of vitality. So for instance, we have Russia way down here at the bottom. Their life expectancy isn't very long, but they're also not spending a lot to get there. And then we have Singapore up here, who is very low on the spending and living a very full, vitality-filled life. And then we have us over here, the United States, massively overspending and really not getting a whole lot of return on our investment. So when we look at this, we look at all of our spending. We do have the best trauma care, the best urgent care facilities in the world. But when it comes to total health and wellness, where do we rank? We are 68th. We are 68th. And nations like Ethiopia are beating us in health and wellness. What does that tell us? Eating no food is better than eating our food. Here's the question I have to ask you. If you keep doing what everybody else is doing, if you keep going with the standards of healthcare, is 68th level health and wellness good enough for you? Is that good enough for your family? Or is it time to look for an alternative? Is it time to consider that there is another option and that there are better answers out there? And just as Thomas Edison said, the doctor of the future will give no medicine, but will interest his patients in care of the human frame, diet, and the cause and prevention of disease. That is the answer to our healthcare crisis in the United States. I'm Dr. Jay Hitson with Transformation Life Centers, where we get you healthy at the cellular level.